Hi, I'm Nurse Ogechi. Welcome to my YouTube channel. So today I'll be talking about PCOS. We've been hearing PCOS, 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 but a whole lot of persons don't actually know what PCOS is, and that is what I'll be talking about today. If this is your first time coming to my channel, please don't forget to subscribe and also turn on the notification button so that you'll be notified whenever I make a post. Then I know this video would benefit you. Don't forget to like and comment. So let's talk PCOS. PCOS is short for Polycystic Ovarian Syndrome, or some persons call it Polycystic Ovary Syndrome. They are all the same. And this is a common health condition which is caused by an imbalance in the reproductive hormones. Then this imbalance causes problems in the ovary. The ovary is that part of the reproductive system that makes the egg, which is released during ovulation. With PCOS, the egg may not develop as it should, or it may not be released during ovulation as it should. The exact cause of PCOS is unknown, but experts has linked it to a number of factors, which includes genetics too. And these factors are high level of androgens and high level of insulin. And high level of androgens, we all know that androgens are also called male hormones, although women also have these hormones in small amounts. Now, androgens control the development of some male traits like male pattern baldness and lots more. Women with PCOS have higher than normal amounts of androgens, and this higher than normal amount of androgens causes the inability of the ovary to release eggs as it should. In women with PCOS who have this higher amounts or higher than normal amounts of androgens, they could also have acne and excess hair growth, which are two of the major signs of PCOS. High level of insulin. Insulin is that hormone that controls the way food is being changed in our body into energy. Now, in insulin resistance, which is one of the factors in people that have PCOS, the body is not able to respond to the insulin in the body. And since the body is not responding to this insulin in the body, it thinks that there is no insulin. So it keeps on producing more insulin, leading to a higher than normal amount of insulin. This higher than normal amount of insulin is usually present in women that are obese or who don't eat healthily or exercise. And this higher than normal amount of insulin could also lead to type 2 diabetes. Some of the symptoms of PCOS include irregular menstrual cycle. Women with PCOS could have fewer cycles, or their cycles could become more often, or they could just stop seeing their periods totally. Another symptom is acne on the face, on the chest, and on the back. There could be abnormal hair growth. This is called hirsutism, where women start experiencing excess hair growth on places where men usually experience hair growth, like on the face, on the chin, on the chest, and it affects about 70% of women with PCOS. On ultrasound, there could be presence of cysts. These are fluid-filled sacs on the ovary. There could also be thinning of hair or male pattern baldness. There could be darkening of the skin on the neck, on the groins, and also under the breast. There could also be skin tags. These are excess flaps of skin on the armpits and also on the neck. There could be weight gain or inability to lose weight. Currently, there is no cure for PCOS, but it can be managed, and the management depends on if the woman wants to have children, maybe now or in the future, or if the woman has no plans of being pregnant. For people that have no plans of being pregnant, they could be placed on anti-androgen medicines. This will help to control the effect of androgens. They could also be placed on hormonal birth controls like the pills, patch, and the shots. This will help to regularize the menstrual cycle, and also they could be placed on insulin sensitizing medicines like metformin to control insulin. They would also be advised to adopt healthy lifestyles like exercising, eating healthily to help them maintain a healthy weight. Now, for those who plan to become pregnant now or in the future, they'll be placed on drugs to induce ovulation. They could also be advised to go for in vitro fertilization. In conclusion, some persons say that women with PCOS would not be able to ever conceive. But from the management I already mentioned, you can see that it is totally possible to have PCOS and still conceive with proper management. Some persons don't even really do much and then they are able to conceive. So that is a myth I want to debunk. You can conceive even with PCOS with the proper management. Some persons also ask if it is possible to have PCOS and not experience those signs and symptoms. Yes, it is very possible. Some persons just get to know that they have PCOS when they want to get pregnant and they keep trying and trying and they don't have, and they are not able to get pregnant, and then they go to the hospital and after some series of checks they discover that they have PCOS. So it is possible to have PCOS and not experience those signs and symptoms. But if you think that you have PCOS, please don't fail to go to a hospital for proper diagnosis and management. This is where I'll drop the topic, and that is the basic things about PCOS. If you have more questions to ask, please do let me know in the comment section. Don't forget to like and comment, and please, most importantly, to subscribe till I come your way next time. Bye.